Hello, I am Karlene Lawerence, Doctor of Nursing Practice and an adult nurse practitioner. I'm also co-director, clinical coordinator of the Bridge Interprofessional Team, and a clinical assistant professor in the College of Nursing here at SUNY Downstate. Today I'm presenting older adults, healthy aging, preventive health evaluations, screening, vaccines, and testing. This presentation is funded by one of the grants on our service, Geriatric Psychiatry Service. It's the HRSA grant, which is to educate the next generation of healthcare providers to be age-friendly and dementia-friendly. I don't have any conflicts of interest, financial or otherwise, to declare. These are some of the acronyms that we use throughout our presentations, and if I am using one of these, I will explain it at that time. Our grant is based, and on our service, our clinical evaluations of our older adults on our service is based on the 4M's framework. What matters, which is not the chief complaint, we actually ask our patients and caregivers what matters to them. Medication reconciliation to decrease polypharmacy and any incidences of adverse reactions from medications not being taken correctly. Mentation, we are geriatric psychiatry, so we screen our patients at every visit and compare one visit to the last. And also mobility, we assess their functioning, their ability to independently care for themselves, and hopefully assist them to stay in place, aging in place in their residencies for as long as possible without the need to be admitted to a skilled nursing facility. This grant is a collaboration between the John A. Hartford Foundation, the Institute of Healthcare Administration, and the Catholic Health Services of New York. This presentation, or self-learning module, is one of the topics in our learning module group E. As you can see, older adults, healthy aging, and preventive health. The learning objective for this presentation is to, one, identify the multi-dimensional factors of wellness, name at least 3 age-friendly healthcare interventions, discuss the impact of integrating the 8 dimensions of wellness in older adults' healthcare plans and goals, and recall at least 5 recommended adult vaccines or boosters for older adults. What is wellness? Wellness includes the following multidimensional factors of life that affects overall health, and not only for older adults, for all persons. Your physical health, your intellectual and mental health, emotional, spiritual, social, financial, and occupational and environmental health. The wellness wheel on the left actually expands on what each of these topics entails. So overall health is not just your physical health, it's not only your mental health, because we are geriatric psychiatry, it's the overall well-being of an individual that affects your actual health, physical health, but also your health, which includes your families, caregivers, friends, relatives, and your interaction with them, and also your interaction with your environment and where you live. Preventive health and wellness exam includes assessment of sleep hygiene, how well you're sleeping or not sleeping, your mental health, any diagnoses of mental disorders, life stressors that you may be experiencing in your relations, sexual health, sexual transmitted, if you have any infections in your sexual health, in your sexual life, employment and finances, your family dynamics. Are you the head of the household? Are you the grandparent caring for your grandchildren? Are you a sandwich generation between your aging parents and your children? Domestic abuse and violence, neglect, emotional, verbal, or physical. Eating disorders, which includes anorexia, bulimia, or abuse of laxatives. Cigarette or alcohol and substance use or abuse. Legal or illicit substances. Your support or coping system, who's there for you when you need to speak to someone, or if someone is there to pick you up when you're feeling down. So does that include family, relatives, friends? If not, then is there a teacher, clergy, or someone else that you rely on, or is there for you? And need for counseling and referrals as indicated. So this is what a preventive health exam includes. And not only these topics, but these are the main topics. So first we'll start with the general physical health. So adults 21 to 65 years are recommended to have a screening exam every 1 to 2 years. And most insurance companies will pay for this exam every 1 to 2 years, which includes a check of your vitals, which includes a blood pressure, your weight, your height, and between the weight and height, we calculate what's called your body mass index, and a physical exam. Blood tests, including urinalysis. So this presentation, again, is about older adults, but I'm also mentioning what other that may be viewing this video are also requested or advised to have for their daily wellness. So adults aged 50 to 65 years are recommended to have a general physical exam, health exam every year, so annually. And including all the topics that were listed above, the blood pressure, the weight, the height, your body mass index, your physical exam, whatever blood tests or urine tests that may be indicated. It also includes screening for cholesterol, for lipids or cholesterol, your high density cholesterol, your low density cholesterol, and the ratio between that, and discussing the effects of having high levels of cholesterol, what the risks are for your health and well-being. And adults aged 20 and older are recommended to have a general health physical exam every 2 to 3 years. Immunization and vaccines. So these are the 2020, I know it's a very tiny slide, the print is tiny, but these are the 2024 recommended adult immunization schedules as recommended by the CDC and the Department of Health. I will go into them in more detail. So immunizations that are recommended for most adults, but again, our topic is for older adults, is hepatitis A. So adults are recommended to have 2 to 3 doses at least 6 to 18 months apart, depending on the vaccine type. We're also recommending for our patients, for our older adults, to have an influenza vaccine, which is recommended for all adults starting at age 18 up and older every year. So every year there's a new vaccine that comes out, and we're recommending our patients, to our community residents also, to get an influenza vaccine every year. So this is for prevention. You want to get it before you actually become ill, to prevent you from getting the flu or prevent you from getting hepatitis A or any of the other vaccines I'm going to discuss. Hepatitis B is 2 to 3 doses, also 4 to 6 weeks apart, and again, depending on the type, which is the brand, depending on the brand. Tetanus diphtheria vaccine, and that is every 10 years, starting at age 18. A pneumococcal vaccine, starting at age 65 and older, and a tetanus vaccine, different types. So the first one was for pertussis, which most children get, and this is TD, which is most adults get, going on as you age every 10 years. And there's 2 different kinds of the pneumococcal vaccine. Measles, mumps, and rubella, which we got as children. We got a first shot as infants, but we need to get, we're now recommending titers as you get older. Some adults, depending on when they draw your blood test, they may not see levels in your blood, and it's recommended to get what are called booster shots. And that those are 1 to 2 doses for older adults. Meningococcal or meningitis vaccine that starts about 16 years old. We usually recommend it for younger adults that are in school, but also recommended for older adults. And that's 1 to 2 doses plus a booster shot every 5 years. Varicella or chickenpox vaccine, again, we get those starting as infants, but it's also recommended as you get older, as sometimes the titers are not still there, the protection is not still there, and it's recommended starting as infants, but also recommended for older adults, and that's 2 vaccines 4 to 8 weeks apart. There is Haemophilus influenza vaccine, again, also given as infants, but again, boosters or additional doses are recommended as we age, as older adults, as adults age. Herpes zoster vaccine. So when we get chickenpox as adults, even after we recover, the virus stays in our system. And as we get older, our immunity is not as strong as when we were younger. And that chickenpox may come back, but it comes back in a different form. It's called herpes zoster. And it's very painful vesicles, bumps that come along in different areas of your body. So it's very painful, as I said, it's very disabling. So there's a vaccine to prevent that from happening as we age, and that's recommended for adults starting at age 50, and that's 2 doses every, I think, about 3 to 6 months apart. HPV vaccine, again, recommended for to start as a younger adults and teenagers or younger children about 12 years of age. And this is to prevent males and females, and this is to prevent from getting what's called genital warts, again, another painful illness when it does erupt or when it does happen or manifest itself. And that's recommended starting between age 9. There are 2 doses, 6 months apart. But as we age, as I said, sometimes our immunity is not as strong. And the vaccines that we received as children, the illness may actually manifest later on in life because our body's ability to block it is decreased. So that's given 4 weeks apart. And again, it's for males and females, not only for females. So these vaccines that I am presenting are not only for one gender, it's for both genders. And of course, there's COVID-19, which we started being aware of back in 2020. So that there's now a vaccine for that, thankfully. And it's, again, for males and females, starting at 6 months. So babies at 6 months could get their first vaccine, and it continues throughout the ages as we age. And now, even if you did receive COVID vaccine back when the infection was more prevalent, more increased, you're now recommended to get booster vaccines. And the recommendation is still to get booster vaccines, just like the influenza vaccine. It's recommended to get that every year. So, and there in the works is actually combination vaccine of the influenza with the COVID-19 virus. So that is also recommended. Starting maybe 2 years ago, we were also advised now that there's called RSV, which does affect mainly children, but again, as our immunity decreases, it's also affecting older adults. It's a respiratory or lung infection. So there is a vaccine to prevent that or to prevent the bad effects from if you do get that. But prevention is always better than cure. So it's recommended to get it before you actually need it, and that's starting at age 60. And of course, as I said, the COVID vaccine, then boosters, there is always being updated and always being advanced. The combination of the medication that you're given. So as keep an ear out or keep being abreast of what's happening in the healthcare field, and definitely stay up to date on your immunity and vaccines. So adults at highest risk for the RSV include older adults. As I said, as we age, our immunity is not as strong, and to ward off and prevent different infections, even if we did receive the vaccines when we were older. So adults with chronic heart or lung diseases or any other chronic diseases like hypertension, high blood pressure, heart disease, those adults are recommended to definitely receive the RSV vaccine. Adults with weakened immune system, so if you already have an underlying illness that weakens your immune system, like HIV, then definitely you're recommended to receive this vaccine. Adults with certain other underlying medical conditions, and as I said, it varies. Having any of the triad, as I call it, the high blood pressure, the high cholesterol, or the diabetes, actually does weaken your immune system. So you are among those adults that are recommended to get this. That if one person ends up being infected with the vaccine, then it could spread among the population. And symptoms of RSV infection usually include runny nose. It's like getting a common cold. Sometimes you think you have the cold, but then it progresses and becomes more severe and more serious. And again, getting the vaccine prevents you from ending up in the hospital in, say, in an ICU, intensive care unit. Coughing, sneezing, fever, and wheezing. So if any of these happen and you never had it before and it came on suddenly or gradually, definitely follow up with your healthcare provider. These symptoms usually appear in stages and not all at once. And people infected with RSV are usually contagious 3 to 8 days before any of these symptoms happen. So you could have gone to a gathering, gone to an outing. Somebody there could have had RSV. They may not know they had RSV, and you're exposed because symptoms don't start happening until 3 to 8 days after you're actually infected. So it's not that the person had it and came to the party and now you're infected. So this is another slide. Basically saying what I presented before, that older adults are at high risk for severe RSV illness. And each year it causes serious illness in older adults and 60,000 to 160,000 hospitalizations and 6,000 to 10,000 deaths. So you can pass away from having RSV. Influenza infection, you could actually die from the flu. Any of the other illnesses that I presented that have a vaccine associated, you could actually die depending on your underlying health condition or decreased immunity. Vaccine for these groups is adults, older adults, age 60 and older. You get 2 vaccines. Those are the brand names. There may be others, but those are the ones I'm aware of and that was in the literature, have been licensed by the Food and Drug Administration and recommended by the Centers for Disease Control for adults age 60 and older. So for older adults, they're recommended starting at age 60 to get this vaccine and using shared clinical decision making. So again, although it's saying 60 years old, it's not a hard and fast 60s. Again, if you have underlying health conditions or you have chronic health conditions, or you've had them for a while that decrease your immunity or cause a lot of illnesses, then depending on what you and your healthcare provider discuss, you may actually be recommended to get this vaccine even before age 60. Pregnant women also, to protect them and to protect the baby that's developing, and infants and some, of course, young children, because that is actually where the virus first started happening, is among children and young babies. And it was very, very serious. A lot of children actually did die. The flu vaccine, which comes out every year, is also definitely recommended. And it's, again, starting at 6 months, babies do actually get the flu vaccines. Again, prevention is better than cure. You want to prevent it from happening at all. And then if you do actually end up with it, unfortunately, the cure may be more complicated. So that's why we're trying to prevent it before you actually end up contracting the flu. So the flu is actually still recommended every year. Well, it is usually an announcement on the radio. The flu season or the flu prevention season usually starts at the beginning of the fall, like right after the summer in September, October. That's when you're recommended to get your flu vaccine so that it's in your system and working by the time the flu season actually starts. So that's why we don't wait until you have the flu to take the vaccine, because then it takes a little longer to work. The recommended timing for vaccine is the same as the last year, the same as last year. It's usually the same every year. But there are usually changes in the flu vaccine from one year to the next, and I will discuss that going forward. Most people need only 1 dose of for the season, and as I said, between September and October is usually the perfect time to get it before the flu season actually starts. Being overweight is a chronic illness, and being overweight predisposes you, increases your risk of getting a lot of the other illnesses that we were discussing before. A third of the U.S. adults are overweight, and the Centers for Disease Control and Prevention, Disease Control and Prevention. Obesity rates increase steadily throughout the U.S. over the last 20 years in all age groups. And obesity increases the risk, as I said, of other illnesses and causing other illnesses. And if you have other illnesses, it also can increase the risk of them being worse or getting worse. Screening for obesity is part of your annual physical exam. As I mentioned before, it's a ratio between your height and your weight, and that you would discuss with your healthcare provider. So your weight in pounds, that's the formula that we use to calculate it. And a BMI of less than 18 is actually underweight. A body mass index, BMI, between 18.5 and 24.9 is normal, considered normal. And anything over that is overweight to being obese. And being obese, as I said, predisposes you for so many other illnesses, including arthritis, because of the increased pressure and weight on your joints. The skin is the largest organ on the body. It is actually an organ. In adults, in an average adult, it's approximately 8 pounds. And skin is at risk of developing its own illnesses, and the number one is skin cancer. The ones that are preventable is skin cancer, and skin cancer is called melanoma, and there's different kinds of melanoma. There's basal and squamous cell carcinoma, which can develop into skin cancer. That's carcinoma, and occurs more commonly in males. But that being said, that it occurs more in males, does that mean women are safe and should not take precautions? High-risk persons for getting skin cancer are persons with fair complexion. If you regularly use an indoor tanning bed or go for tanning at a salon, a history of sunburns, if you've ever had a sunburn, that increases your risk of having skin cancer later on. And the risk factors are what you usually see that you definitely should discuss with your healthcare provider is what's called an atypical mole. So it's not usually, if you've had moles your whole life, it's also recommended that you have regular follow-up visits with a dermatologist, and they will map your moles to make sure. So when you come into care, they map your moles. So this is what you came into care with, and at this point in time, you're free of cancer. And then they will follow those moles annually to see if they're changing in size, changing in color, changing in shape, because any of those would indicate that mole may be developing and becoming cancerous. Having multiple moles, again, they're called nevi. That's, again, follow up with your dermatologist. Or if you've had a personal history, so anyone in your family that's had skin cancer increases your risk of actually getting skin cancer. Prevention for having skin cancer is to avoid direct sun exposure between 10 a.m. and 4 p.m. That's when the sun is at its brightest and hottest. And definitely wear a hat when you're outside. If you're going outside, not only at the beach, definitely wear a sunscreen. And the higher the SPF, you look on the bottle, if the SPF is higher, 15 or over, I think it's up to 20 or over, the higher the SPF is, the better protection that you have. And if you are at the beach, once you go into the water, that sunscreen that you put on gets washed off, so you have to reapply. So it's not like you put it on one time for the day and you're protected. If you're going into the water, then definitely when you come back out, you need to reapply it again. And also, your dermatologist or your primary care will also advise you, if you're at a higher risk of getting skin cancer, how to perform a self-exam for yourself at home. So if you see anything doing your self-exam, then definitely follow up with your healthcare provider. So the eyes are windows to the world. As we age, our eyes, definitely also age with us. So the recommended screening for adults age 40 is to, once you become age 40, is to have a dilated eye exam. So this is not you go to Costco or to any of the other stores and they do a test. You actually need to go to an ophthalmologist, and your primary care provider could refer you to an ophthalmologist, and they will dilate your eyes. If you're going to have a dilated eye exam, you cannot drive yourself home because your vision will be blurred. So if you're being scheduled for a dilated eye exam, you will be advised to have someone accompany you, and also to drive you home or help assist you to go home. Adults aged 40 to 55 years are recommended to have an eye exam, not a dilated, just a regular eye exam every 2 to 4 years. Adults 50 to 64 or older adults are advised to have an exam every 1 to 3 years. Adults age 60 and over are recommended to have a dilated eye exam, again, where they put the drops in your eyes, and you need someone to go home with you every 2 years. Adults every 1 to 2 years, depending on your underlying issue. or no issue. If you're just doing for prevention, it may be 1 year, but if you already have been diagnosed with an eye illness or a diagnosis, then you may, depending on your provider's discretion, you may be recommended to come in earlier than every 1 to 2 years. Most health insurance companies will pay for a new set of glasses every 2 years. So you have an eye exam and you're recommended your prescription on your glasses change. You may require something that helps you to see better. Most insurance companies will pay for a new spectacles, eyeglasses every 2 years. Risk factors for permanent vision loss, again, having diabetes, high blood pressure, high cholesterol, anything that can affect your heart. So having diabetes, high blood pressure, high cholesterol actually can adversely or cause bad outcomes or another set of illness that can affect your heart. Adults with diabetes are recommended to have a dilated eye exam every year, and again, at your discretion, or also with discussion with your healthcare provider. And adults with high blood pressure are recommended to have a dilated eye exam every 1 to 2 years. And again, that could change depending on your actual specific illness that you're aware of and that your healthcare provider are aware of. I will discuss the blue box on the left after. Your ears, again, very important for hearing, but not only for hearing. As you can see in the box, it also can lead to dementia. And adults are recommended, all adults, male and female, are recommended to have a hearing test with an audiologist starting at age 20 to 49 is every 3 to 5 years if you don't have any prior diagnosis or you don't have any issues that you're noticing. Adults age 40 to 64 years are recommended to have an eye exam every 2 to 4 years, and adults age 65 and over are recommended to have an eye exam hearing test every 1 to 2 years, in addition to your eye exam. If you have any other issues outside of that time, so you went to see your healthcare provider and after that you start hearing a sound in your ear that's like a high-pitched sound. It's not from nobody else is hearing it but you. It's only you that's hearing this like continuous whining sound in your ear. It's called tinnitus. That's reason to go back to your healthcare provider and not wait for the scheduled follow-up exam in 1 to 2 years. That's a beginning symptom of hearing loss. Also, if you notice any changes from the time that you have your exam, going forward, say a week later, a month later, definitely follow up and don't wait for that yearly exam or every 2-year exam. Follow it up as soon as possible because, again, prevention is better than cure. It's always easier, less expensive, and has better outcomes. Prevention when you catch whatever is happening earlier. Having hearing loss or hearing difficulty or hearing deficits, you're not hearing as well as before. Having visual difficulty, vision loss, both or in combination actually could lead to development of dementia and memory deficits. So that's another reason to definitely follow up with your healthcare providers as soon as you notice or if you notice anything. About 20% of adults 75 and over have vision and hearing loss, and research indicate that dual sensory impairment, so loss of vision, loss of hearing, again, typically increases your risk of developing dementia. Symptoms of hearing loss may include, again, not everybody is the same, but these are the common ones that are reported by most persons, is sounds that seem overly loud or in one ear or the other, or sounds are decreased in one ear or the other. Difficulty following conversations. So if you're in a crowded room or you're in the mall or you're in somewhere that's noisy, you have more difficulty hearing when someone is speaking to you. Not just the person standing in front of you, but you have difficulty hearing overall. Trouble telling high-pitched sounds such as S or T, so somebody is saying so or the, and you're having difficulty differentiating between an S and a TH sound. Less trouble hearing men's voices than women's voices because men's voices are lower. Hearing voices as mumbled or slurred, or having to ask someone to repeat what they're saying over and over. So this is something, again, that is may indicate, not definitely, but may indicate that you're having hearing difficulty, and the only way to confirm or to rule that out or deny that is to follow up with your healthcare provider as soon as possible. You could also feel off when you're walking. Your balance may be off because your hearing is at your ears. Your balance is actually regulated in your ears. So if you're you're fine before, and then now you're having difficulty walking, you're feeling off balance, you're drifting to one side, dizziness, presence a pressure in your ear along with the buzzing sound that I spoke about before, tinnitus, then that's definitely something to follow up as soon as possible. Mouth and dental exams. So the American Dental Association recommends dental exams every 6 months for everyone, not just older adults. So everyone should have a dental exam every 6 months, and most insurance companies will pay for that because it's a recommendation from a certifying organization. Dental X-rays can also be included in that, depending on your health insurance, and cavities, gum disease, bone loss, and other problems that can. So that's what they're looking for. Why we are having these exams every 6 months. Your dentist will evaluate if you need for additional tests depending what they find at these regular. So these are regular screening exams or preventive health exams. So if they find an issue, then they will change your plan or recommend some other follow-up that may be needed for whatever may be found. But most persons have a regular dental exam, including x-rays, every 6 months. And again, cavities, having cavities, the infection that may develop in the cavities could actually end up affecting your heart. Other things that may be found in the mouth, bad breath is not something that you should live with. Depending on what it is and what the source is, it can actually be resolved. Having loose or missing teeth affects your ability to eat, affects your weight, affects your overall health, well-being, and getting the nutrients that you need to survive. So it's a lot of persons do not take care of their teeth. It's the lowest priority on their list, but it's very, 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 very important. You may actually develop cancers of the mouth, so you could actually have cancers of the tongue. You could develop cancers in your mouth. So if you have any new sores or any breakdown in the skin in your mouth, that's something that you should definitely follow up on as soon as possible. Our lungs, we're required for breathing. There are a few illnesses that are specific to the lung. Asthma, if you have asthma, you know you have asthma. It can change as you get older, depending on the environment where you live. If you're exposed to any infections in your home like mold or dust or mildew, that could actually make your asthma worse. The medication that you're taking may not be as effective as they were before. These are reasons to follow up with your healthcare provider. Tuberculosis, not as common in the United States anymore, but if you're traveling to another country or coming back from a trip to another country, then you may actually have been exposed to tuberculosis. Again, coughing. So many of these lung illnesses start with coughing. So if you're having a cough for a prolonged period, over a week, that's not getting any better or maybe getting worse, then definitely follow up with your healthcare provider. Acute bronchitis, COPD, persons that have smoked or for other reasons may develop a chronic pulmonary obstruction, so they have difficulty breathing most of the time. Emphysema, another illness that develops from exposure to a noxious substance. Pneumonia, so again, one of the vaccines prevents pneumonia. As we get older, persons do the risk for getting pneumonia does get worse, and pneumonia is a very serious illness that can lead to death. ARDS, respiratory distress syndrome, RSV, as I said before, cancers of the lung. If you're a smoker, actually, some person do get cancer of the lung that have never smoked, but if they live with somebody that smoked, that increases their risk of also getting lung cancer. COVID-19, and just trauma. You were in a car accident, broke your ribs, punctured your lungs, anything that happens. So there's different illnesses that can happen with the lungs. I said anything that changes from your normal, that you're concerned about, that's going on for a long time, that's something to check out with your healthcare provider. Smoking at each visit, wellness visit, annual visit, we healthcare providers do ask you about smoking, and please tell us the truth. We're not judgmental, we're actually trying to help you. So smoking tobacco or illicit substances actually contributes to developing lung problems. Tobacco smoking, we do try to advise you and assist you to stop smoking. So the sooner you stop, I know persons that's been smoking like 20 years and they said, I'm fine, so I'm not interested in stopping. But the longer you go, as I said, as you get older, your body systems do not recover as well. They don't protect you as well. So as you get older, you maybe have been smoking for a while. As you may actually now, your risk is now increased that you may actually develop lung cancer or any other of the illnesses on the prior slide. So smoking cessation, stopping smoking, we're always going to ask you about that. There's assistance for you to stop smoking. There are patches, there's gum, there's medication to help you to stop smoking. And the longer you smoke the more your risk of having any of the other illnesses that I had on the other slide may develop. So whenever you come to see us, we ask at every visit about your tobacco use. We also ask about your alcohol use. And we recommend and advise you to stop. We assess how willing you are to stop and how willing you are to accept assistance to stop. And then we could actually refer you to other healthcare providers that could assist you in your attempt to stop smoking. So smoking, tobacco, chewing tobacco is actually not as well, not good either, because then you're increasing your risk of actually developing throat and oral or cancers of the mouth. Now that marijuana is some amounts of marijuana is increased, I know a lot of persons are smoking marijuana. Just to smoke it, that's not the only way that you can use marijuana, the medical marijuana. Smoking is actually not recommended for marijuana. You could have tea. You could, a lot of persons put it in baked goods. Anything you could do with your legal medical marijuana is fine except smoking. So smoking marijuana, even though that is now legal, still increases your risk of getting lung cancer or any other cancers of the mouth. So healthcare workers and other persons now in the community can develop tuberculosis, as I said before. Tuberculosis testing is not as prevalent in the United States as we used to have where you stick your skin. We're not doing that anymore. There are other more specific, so the results are more accurate. There are more specific testing that you can be recommended for. So we still ask about tuberculosis, but we're not doing the tine. It's called a tine test anymore. And we want to decrease the incidences of lung cancer. Asymptomatic adults, that means so you don't have any symptoms, you're not coughing, you haven't noticed any changes. The governing body that makes these recommendations recommend that you get a low dose scan for persons 55 at age 50 to 80 years. So everyone between age 50 and 80 years should get their first low dose scan of their lungs, just to see if there's anything happening. It's in its early stages that could be stopped as soon as possible. And as I said before, current smokers with a smoking history, it says here 15 years, but any smoking history at all is also recommended to have this low dose scan as soon as possible. Or definitely by age 55 or between 55 and 80 years. Another governing body that makes recommendations, healthcare recommendations, the American Heart Association recommends checking blood pressure every visit. So every healthcare visit, that's why we check your blood pressure. And we're checking to determine if you have high blood pressure or not. And if you have high blood pressure, you may follow up at shorter intervals with your healthcare provider to make sure that the levels are not are in control or within the normal ranges. Because having high blood pressure not only is not just like having high blood pressure or having hypertension. Having the blood at that pressure, so your blood is actually pumping from your heart at a very higher pressure than normal, can affect your brain, affect your heart, affect every system of your body in a bad way. So that's why we check and we try to get you on medication and follow up with you about how are you taking your medications properly. And the number one, I think most people know that it actually can cause you to have a stroke. So adults with elevated blood pressure should have their blood pressure checked every 6 to 12 months. And again, it may be different depending on what your healthcare provider knows about you and what they recommend. Adults with normal blood pressure, so within the range, can have their blood pressure checked at least every 1 to 2 years. An EKG, so that's a check of your heart where they put the pasties on your chest. If you're diagnosed with hypertension, you should have your first EKG once you're diagnosed with hypertension. As I said, it can adversely cause problems in your heart. And then follow-up EKGs every 1 to 2 years to make sure that there's no, it's not worsening if there's something was found, or if it was normal, if something is happening now after the first time you had an EKG. Cervical cancer screening is recommended for females that are sexually active starting at age 15 if they're sexually, or once they become sexually active, it's recommended that they have cervical cancer screenings or pap smear with a human papillomavirus test every 2 years, because having undiagnosed sexually transmitted infections definitely can, and untreated, can lead to cervical cancer. Low-risk cervical cancer screen are for persons between ages of 29 to 65, and there's also a human papilloma test that goes along with that, and that's every 5 years. And low-risk individuals are women in a monogamous relationship, so they have one partner. They're not sex workers. They don't have a family history of cervical cancer, and they don't have any family or actual occurrences of human papillomavirus. So that's what a low-risk person is, and they recommend to have screenings every 5 years. So their first test was negative, their follow-up test could actually be in 5 years. And then as they age, if they've had 3 or more normal results from their cervical cancer screen, then they could actually stop having cervical screens after they've completed 10 years. So for 10 years, they've never had any positive or abnormal results. As they age, after 10 years of having abnormal results, they could actually stop having cervical screens as they get older, age 60, 65 and over. And any other, depending what your healthcare provider may notice or diagnose, then your actual regimen or recommendation for follow-up or having screens may be different or change as you age. So us healthcare providers actually used to do self-breast examinations. A lot of healthcare providers are not doing breast examination as much anymore, and this is for males and females. We used to do breast exam in the office, but we recommend and we definitely advise and we will instruct you how to examine your breast yourself at home. So we want you to continue examining your breast at home, because most cancers that are found by the person at home or by their partners. So starting at age 18 and over, you should start examining your breast, and what you're looking for is anything that feels abnormal. So the reason we're starting at 18, at age 18, your breast should still be, unless you have a family history or you've had a history yourself of something abnormal, your breast should still be healthy. That's why we recommend in age 18. And you're examining your breast. And if you notice anything abnormal, because some persons have lumpy breasts, and you may be thinking this is a cancer, then definitely let us know, your healthcare providers, and have us follow up with you. But starting at age 18, you should be able to examine your breasts, and you try to do that every month. And usually after your period is over, so about 5 days, because your breast does change while you're having your menstrual periods. At 5 days after your menstrual is over, you examine your breast. So, and if you notice again anything that you think is concerning, then definitely let us know. What you're feeling for, and hopefully not finding, is any lumps that's hard. So you may find a lot of soft lumps, but if you find something that feels hard, like a frozen pea, like the little green peas that we have, then that's something to definitely let us know as soon as possible. So that's what you're checking for and hopefully not finding. And also same for men. Men actually do get breast cancer. So definitely if you find anything hard, then definitely let us know. You're also squeezing your nipple to see if there's any discharge. So you may get some clear discharge, but if you get anything milky or any other color but clear, then that's something to let us know also. And reason that us healthcare providers are not really doing breast exams routinely anymore is because we send you for sonograms and mammograms, especially again if you had an abnormal finding, if you had a family history of someone in your family that had breast cancer. So it would be your mother, your aunts, your mother's sister, your father's sister, your grandparents, anyone that had breast cancer in your family. You'd start screening earlier, and you would have sonograms and mammograms earlier and more often. So breast cancer screening, it says a woman, but also males, may complete a clinical breast exam during a preventive health exam. However, experts don't agree that this is a benefit, so that's why a lot of clinicians are not doing breast exam in the office anymore, but we're sending you out for a mammogram or a sonogram. So the recommendation that women between the ages of 40 to 75 are recommended to complete a mammogram every 1 to 2 years to check for evidence of breast cancer, and hopefully early where it's treatable and has better outcomes. Again, depending on their risk factors. So again, low risk factor, you never had breast cancer, no one in your family has had breast cancer, so that's a low risk. Again, your healthcare guidelines do not agree, again, on the recommendation of benefits of women aged 75 years and over continuing to have mammograms. So if you've been having mammograms since you were 18, every 1 to 2 years, and they've all been negative, again, you are low risk. And at age 75, you may not have to continue having mammograms. But again, if you've had anything abnormal that's been treated, anything in your family, then your recommendations may be individualized and different from someone else. So as I said, we're going back and forth about doing breast exam in the office, but some clinicians actually still do breast exam in the office. And again, just definitely discuss it with your healthcare provider. But this also emphasizes the importance of having these discussions with your parents, because I know I'm from the Caribbean and a lot of our parents don't like to discuss their health conditions with us, but this is something that all females and males should know if there's a breast cancer diagnosis in their male or female relatives. So males also are recommended to have testicular exam. There is testicular cancer, so you get cancer of the testicles. And again, higher risk is a family member that may have had it, or if you had it before. So that's a higher risk population. And the clinician in the office does not usually do testicular exam, but some do, depending, again, on your history. And also there's a prostate exam where they're checking for prostate cancer. And a lot of men are really uncomfortable with this exam because it's actually an insertion of the fingers to see if there is actually any abnormality in the prostate. So instead, a lot of men are being sent out for the blood test instead, but you definitely should follow up and have this done at the recommendation. If, again, starting between age 40 to 45 years, you start having regular prostate exams or the blood test. But again, if you had a history of prostate cancer or anyone in your family, any males, father, uncles, brothers that had prostate cancer, your recommendations are going to be different, and the interval of follow-up, like repeating it, is going to be different. But definitely have the test done. Again, the earlier it's diagnosed, the better the outcomes. Osteoporosis is having breakdown in our bones, and it happens as we age, or if our nutrition does not include adequate amount of calcium. So the American College of Obstetrics and Gynecology recommend bone mineral testing for women starting at age 65 years. And postmenopausal women, so women after their menstrual periods have ended, are to continue having osteoporosis or exams, because one of the beneficial effects of having menses is that we have adequate stores of estrogen, and as we age, that decreases. So postmenopausal women that's over 65 years have an increased risk of osteoporosis or softening or bone fracture from osteoporosis. So the amount of bone material that's there is lessened, and because of that, our risk of having fractures or breaking of our bone is increased. And breaking your bone actually has a lot of really adverse effects, including, depending on which bone is broken, actually can lead to death. So the DEXA scan, please definitely have it done if you're recommended by your healthcare provider. The DEXA scan should not be performed more frequently than every 2 years, depending on your history. If you're high risk, so this is a person that's low risk, but if you're high risk, then definitely your healthcare provider may have you complete a DEXA scan at a shorter interval than every 2 years. And a fracture assessment scale predicts your risk of having a fracture depending on what the DEXA scan results are, and that could be done every 10 years. The U.S. Preventive Service Task Force recommend osteoporosis screening for women aged 65 years and over, and again, younger depending on your risk factor. It's also recommended for males at age 70 and those 50 to 69 years who have a risk factor or have had a fracture as an adult or had a history, a family history. So men are also recommended to have screening for osteoporosis and having an DEXA scan, so it's not only for female. The Endocrine Society guidelines recommends the following high-risk males be screened for osteoporosis management with a DEXA scan. Again, those age 70 and over, between 50 and 65 years, if they have the following risk factors: low body weight, they're smokers, or had a previous fracture, and I'm going to add also having a family history of having a fracture. Colorectal cancer, so that's cancer of the colon, is actually treatable if it's found early. So colorectal cancer screening is a colonoscopy, and the recommended age keeps changing. The latest literature says between 40 to 45 years. That's a low-risk person. Again, no family history or no personal history of having colorectal cancer. And the earlier it's treated is the better the outcome, the more curable it is with better outcomes. A repeat negative, so if you had a colonoscopy at 45 years and it's negative, the next time it's recommended is between 5 to 10 years. And again, once you get to age 75, if all of your colonoscopies have been negative, then it's recommended that you don't need to have any additional colonoscopies. I know a lot of persons are really apprehensive, are fearful about doing the PrEP. The PrEP is the worst part of the colorectal cancer screening because most persons are put to sleep during the actual colonoscopy. So drinking the gallon of fluid is what everybody's afraid of. It's one day. You're not going to starve to death. And once you have it done, you actually weigh less because you're completely clean. And they will go, there's a new recommendation or new preference for having the Cologuard, which is doing the stool sample at home and sending it off to the lab, which is fine. But if that comes back positive, you're still going to be recommended to have a colonoscopy. So it's every 10 years. Drinking the liquid is the worst part. Just make up your mind that it's going to happen and have a colonoscopy. So those are the recommendations for having a colonoscopy. Again, high-risk person, having cancer yourself, so in the colon or in the rectum, or having a family history of someone with colorectal cancer. There's actually no recommendations for screening the extremities unless there's an actual problem that you're going to tell us about, unless you have diabetes, because when you have diabetes, it actually affects every system of your body. So a lot of persons with diabetes, especially if it's uncontrolled, their blood sugar is uncontrolled, could end up with decreased circulation in their feet. So you would be recommended by your primary care provider to actually see a podiatrist, which is a person that deals with the extremities, especially the feet. So what they look for is a loss of sensation. So if you're coming in and you're saying you're having tingling, they touch your feet or they do a test on your feet and you said you don't feel it, then you're actually developing what's called peripheral vascular diseases. So the blood vessels in your feet are actually breaking down because of your out of control sugar in your or glucose in your blood and your system. So what they're looking at is a very low risk. So there's no loss of sensation. There's no loss of affecting your mobility or ambulation or your ability to walk. And if the screening, if the first test that you do is 0, then your next test is recommended every year. So once you're diabetic, you should have this test every year if you're at low risk. That very low risk, sorry. When you're low risk, so you have some loss of sensation or some development of peripheral arterial or vascular disease, then you're recommended to have this test every 6 to 12 months, depending on what is found. And a moderate risk, your sensation decreases, you have more evidence of developing arterial issues, or you're having difficulty walking, then the recommendation as far as follow-up, the intervals decrease. As you could see, it's moderate risk is every 3 to 6 months, and a high risk is where you're actually having problems that you are able to notice, and their recommended follow-up is every 1 to 3 months. So there's no preventative screening test for the brain unless there's a problem that you've noticed. Then you speak to your healthcare provider and you're referred for follow-up. So these other systems of the body really don't have regular recommended preventive screening. The brain, the nose, the chest, the liver, the stomach, spine, or the back, and the extremities if you're not diabetic. So these other systems don't really have regular recommended screenings, but definitely if you see something, you know your body best. If you see something abnormal, definitely let us know. Okay? So culture is a core element in the delivery of healthcare services and influences how patients and families understand experiences and respond to health interventions at all life stages, including the life years and at end of life. Older patients may have traditional health beliefs. As I said, I'm from the Caribbean, and one of the beliefs is that if you discuss death, like planning for it, getting your funeral arrangements in order, setting up somebody to be your healthcare proxy, or setting up a living will, like this is what I want if I go into the hospital, or this is what I don't want if I go into the hospital, actually brings death on faster, and that is definitely not true. Failure to plan is the worst thing that could happen, because there's no time. Even though this presentation is for older adults, there's no guarantee that you're not going to have any issues or not going to pass away as an older adult. It could happen at any time. So planning for it is the best thing to do so that your family is not caught off guard or you're not caught off guard. So those are some of the beliefs that I am aware of. So culture facilitates and impacts patient adherence to treatment. So we recommend interventions, we prescribe medications, and a lot of persons will not take it because of their cultural beliefs. So if that's something that's happening with you, definitely let us know. We may not be aware. It also affects making decisions about healthcare choices, because depending on the hierarchy in your family, maybe only males make decisions about certain issues in the family or about certain persons in the family, and the females are the ones making the decisions. So also, again, something to let us know. The meaning of illness and rituals, maybe you're more into home remedies and seeing a cultural person, a doctor or a cultural person that will give you a treatment or cure, is also something that you may be favoring. And while we're giving you medications and you're not taking them, please let us know this, because we're assuming that you're taking the medication, although we're doing reconciliations every time we see you. If you're not taking it, then you're actually doing yourself more harm because your illness is progressing. But if your belief is that someone else is more adept at caring for you, then also definitely let us know that. And coping, the different ways, different measures, different beliefs about coping with death and dying. Culture determines the roles of the family, who's the head of the household, who makes the decision, sex-related norms, treatments of older adults and children, religion, spirituality, and related rituals, preferred foods. I know some cultures Like right after childbirth, they will not eat anything cold. They'll only eat stuff that's warm or hot. And sometimes in the hospital, the foods that we bring, they do not want it and they will not eat it, but we don't know why. So it's something to discuss with us. Medical choices, use of cultural practices or folk medicine versus Western healthcare and recommendations and treatments. Patients-related healthcare barriers include limited English proficiency, low to no health literacy, and varying levels of being assimilated into the culture that you are. You may not be comfortable or you may not be accustomed to the cultures. Like if you leave the islands and you come here to the United States, the cultures that you have that are the way things are done here may be not clearly understood by you. That, again, that's something to definitely discuss with us. There may be biases about Western healthcare and medications because of stuff that's happened in history that you may not trust your healthcare provider. If you don't trust your healthcare provider, or if you have a feeling that your healthcare provider is not listening to you and not responding to your concerns, then that's something to discuss with them. And you also have the option of finding another healthcare provider. So don't stay with somebody that you don't think is valuing your input and not take the medication or not taking the recommendations, because you're then actually you're hurting yourself. Discuss that with them, and if necessary, move on and select somebody else that is more favorable to listening to you. You may be distrustful of your clinician. You have the inability to navigate the healthcare system. The healthcare system in the United States is very complex. If we send you for a test and you're unable to schedule that test or follow up with a test, that's something we actually want to know. Cultural concepts of distress. So a lot of persons that are in pain may not actually show signs of pain or grimace or cry or something that we expect to see. They may be very stoic and keep it to themselves. We cannot help you if you don't let us know that you're in pain. So when we ask you, definitely tell us what's happening. And cultural beliefs and taboos, again, about death and dying, about being ill, what foods you should eat. So those are cultural beliefs and taboos. Patient-centered care cannot be provided without an understanding and appreciation of patients' cultural values, beliefs, and practices. Understanding, appreciating, and incorporating patients' beliefs, values, and attitudes prevents stereotypes, biases, facilitates the development and delivery of services, and meet your needs on what matters to you. So when we ask you what matters, we really want to know what matters to you. We don't know everything, so definitely tell us what your preferences are. And you're also educating our students, because we have students that are in clinicals with us that need to find out that all cultures don't do this way. They don't take care of this illness this way. They want this to happen in their lives. This is what's important to them. So you're also educating the next generation of healthcare providers by telling us what is happening. So when you come to the visit and we ask you questions, please tell us. We actually do want to know, and we do care about what is happening with you. And these are my references. Thank you.